Welcome back, 7:23 right now. So last week, the CDC put out an emergency alert to public health officials about a surge in respiratory viruses, especially ones that pose a threat to children. We've talked about this here, but joining us to talk more about what this means for you and your family, our Fox medical reporter, Dr. Mike Cirigliano. Good morning, doctor. Thank you so much for being with us.
Don't call me doctor, Liz. It makes me nervous.
All right. Don't call me late for dinner.
Whenever they say Dr. Cirigliano, yeah, that usually means I'm in trouble. But anyway.
All right, anyway.
Great to be here. Thanks for having me.
Absolutely.
Yeah.
So, you know, the CDC warning, it wasn't just about one virus. So break down what we're talking about here.
Well, it's like a perfect storm, Liz. We have respiratory syncytial virus, which is filling hospitals up with children. That's a virus that we normally see, but we're seeing tons of cases, probably because people were isolated and wearing masks for a year and a half. Then you throw in the flu, and we're seeing record cases of that. Don't forget COVID. And then you have things like rhinovirus. There's viruses all over the place, but not to panic. Number one, you want to make sure you get your flu shot. Make sure you get that COVID booster if you haven't done it. And take care of yourself. You have to make sure that you take care of your machinery so your immune system is good to go. You want to make sure you get plenty of exercise, you get rest, and you eat the right foods. You put that energy into your body, you're going to be just fine.
So, doctor, I mean, we're tracking this year's flu season as well. I mean, health experts have said it's going to be, I know you mentioned it here, but health experts said it would be worse than usual. What do we know so far about those flu numbers?
Well, it's so bad, especially down in the southeastern part of the country. They have a new color. They're using purple because they're having numbers higher than high. That kind of says it all right there. And so, again, because we were in isolation, and if you look at the southern hemisphere of the planet, Australia and those countries had a very, very bad flu season during their winter. They're kind of heading into their spring as we head into the winter up here. And so that kind of is a prediction of how bad it's going to be. So you can either panic, crawl into the fetal position somewhere and cry, or you do something about it. And that means getting a flu shot and all the things we just talked about. Hand washing. Liz, it's basic, but a lot of people don't do it. Wash your hands with soap and water and try not to touch your face. You know, we touch our face about 23 times an hour. It's really something you want to try not to do, because if you touch your eyes or your lips, you get that virus in there. It's a problem.
I am guilty. I'm guilty of that. Dr. Mike, this is great advice. Less panic and more proactive. We love that. Thank you.
Thanks for having me, Liz. You guys rock up there.
Oh, well, thank you.
Rock.
We'll take the compliment any day.
Yeah.
All right. Have a good one. All right.